Hi sir, what is the surgery where you cut down the calcium through blood vessels in bypass surgery?
Oh, yeah, that's a very interesting question. So, what is this surgery exactly where we cut down calcium from the arteries and then do a bypass? Well, this is called coronary endarterectomy. We recently operated on few patients who had really bad vessels, like the guy from US the other day who had flown to India to get a bypass done by me. And trust me, this happens when all the arteries of the heart are completely calcified. So, जब blockages बनते हैं, initially there is deposition of cholesterol inside the blood vessels, and with time the cholesterol, especially if you are a diabetic, very quickly progresses to a stage that there is a lot of calcium deposition on them. Now the whole blood vessel is fully calcified. It is like how you see when you pour cement and it is in fluid form, semi-solid, and then suddenly it hardens. So now this is like cement being poured into your coronaries and the whole thing is hardened completely. Now there is no space left for anyone to either go in and put a stent or do a bypass. So in this cases, obviously angioplasty doesn't work, and we go inside, we open the artery, and then we cut that chunk of calcium and remove it from the vessel. This is like cleaning the drain pipe, and then now you have some lumen where you can do a bypass. So we do a lot of such bad cases these days, and a lot of young patients also need coronary endarterectomy, which is worrisome. But as we did the other day, we did an American guy and we did a heart where the heart function was barely performing at 20-25% with nothing left to bypass. But with this method, which is a very difficult skill to actually emulate, but then since we are trained in this, we could bypass all four vessels, and we finally gave him five bypasses. So I think this is something new, and this is done in high risk cases. And with this, the rest of their life, the heart can again get blood, and they should be doing fine. Thanks.